Good morning. It's great to see a lot of you, and we hope you, like Kent, were rocking out last night. We may have gone to bed early. Melissa, it's great to see you from New York City.
Hello. Always nice to be brought on with Fleetwood Mac.
Yeah. Well, we're delighted to spend a little time with you this morning to take a deeper look at the Foundation's efforts to protect access and coverage for cystic fibrosis, for all the things that we know are really required and vitally important for people with CF. Access to care centers, access to therapeutics, access to all the services that make up CF care. And I'm delighted to really go back and sort of reinforce and make some connections with all the work that we did on Thursday on Capitol Hill. And we also want to take a deeper look under the hood at some of the other things that the Foundation does to protect access and coverage. I'm beyond thrilled to be joined by two longtime phenomenal advocates and friends, Peter Barry and Melissa Shiffman. So can you all tell us a little bit about yourselves and your connection to advocacy?
Absolutely, and before we do that, I think one more time, we've all had a chance the last couple of days to think about what happened 2 days ago. And I think it's time one more time to thank Mary and her team for 220 meetings, 350 advocates, and 125 brand new advocates. Thank you. And I have a special message for Mike, because I was up a little before 6 just getting my notes together. Saw Kent get in line for coffee, and I'm starting to sit down to my notes, and I look at my phone, and there's a picture of Abby and Allie from the North Carolina delegation eating pizza in the lobby at 3:42 a.m. So I don't know when they went to sleep, but Mike, the point is 24/7, 7 days a week, your CF volunteers are on it. We're working. As you all heard, I am the proud parent with my wife Amy of 3 children. Our middle child is Jamie. He's 28 years old. He has cystic fibrosis. He is right here on my wrist. He's my CF hero. Jamie has had and all things considered, a very healthy life, and some early problems with digestion. He had a feeding tube for a while. He's had hospitalizations, but really 2019 was a game changer for us, and he is living his best life now. But I also want to show you my other wrist, where I have the name of Austin Gordon, because we understand that there is 10% that do not have the experience that Jamie's having right now. These are people who, unfortunately, the lottery did not go their way, and they may be in the 10%, they may be too late for modulators, but it's not lost on Amy and I that it would be so easy for Jamie's name to be on this side and Austin's name to be on this side. So the point is, we're here for all of us, and we think we need to remind ourselves at all times that this is a large population that we need to take care of. Okay. Oh, you're welcome. So real quick background, Jamie was born about 28 years ago. We got involved about 27 and a half years ago, mostly on the fundraising side. We were asked by Rich Mattingly, I think about 21 years ago, to try and put together a group of like-minded parents and volunteers to really share best practices about fundraising. And I think the room we got together in was about the size of this stage, so this is pretty amazing to see all this out here. But that became VLC, became what this is now, thanks to the foundation and what they built around that. We did that for 4 or 5 years, and happily then turned that job over to the Casalinas. At that time, Mary asked Amy and I to co-chair National Advocacy. We did that also for 4 or 5 years until we turned it over to the wonderful lady on the screen here, Melissa. Towards the end of that experience, Amy, who was on the national board, and Mary went to Capitol Hill, and it happened to be the spring break for my oldest son, Will, who does not have CF. He's 2 years older than Jamie. And Amy said, hey, you want to come with us? And he attended the meetings. I know Cam, we were talking about this the other night, Cam was in those meetings. And what happened in there were conversations with a teenager not affected by CF and the congressional office, and we said, ooh, there's a germ of an idea. And Mary and her team ran with that, and that became Teen Advocacy Day. After that experience, my involvement, as noted, has been as an advocacy chair in Western North Carolina. And in 2018, a good friend from Raleigh, John Kelly, and I piloted the first rollout of the Captains program, which was in North Carolina. And since that time, I've been district captain for District 11.
It's too bad you don't do anything, Melissa?
Hi, everyone. Melissa Shiffman, New York City. I am an adult living with cystic fibrosis. I just turned 50 this year, which yeah, it was incredible. My husband threw me a huge surprise party, and I forget sometimes that it's not just me who has CF, it's my whole family who deals with CF, so it was a big celebration. So I was diagnosed at 5, like Kathy said, because my brother, who was 2 years older than me, was diagnosed with cystic fibrosis. It had been like, he was very sick and everyone thought he had pneumonia and he was in and out of the hospital. And then finally, a family doctor of my parents from Brooklyn figured it out. And, and we were both diagnosed. Our stories, our trajectories were very different. He was very sick, my brother Jason, and passed away in 1988, just before the gene was discovered. So he's my bracelet, even though my bracelet looks different than yours, guys. I'm not there. Yeah, so my family has been very involved with cystic fibrosis, also fundraising. And then as an adult, I became involved with Great Strides. I had my own team, shout out CF on the LES, June 5th walk, New York City. And, for years, the first time I participated in Great Strides, it turned out I was pregnant with my first child, who is now 19 and in college. And I have another 16-year-old. I don't want to leave him out. In 2000, the second child, I'm one. In 2011, the executive director at the Greater New York chapter called me and asked if I would be interested in being the state advocacy chair and attend an event where I would meet my legislators and share my experience as an adult with CF. I was kind of blown away. I was never thought about anything like that before. It was a program that was, they were trying to ramp up. Personally, I had never been very active in politics outside of voting, but I had just gone to school for social work and learned about how policies affect people's lives. So I thought, yeah, well, of course, I should try it, So I went down to DC, and as a person with CF, it was so empowering to share my story and my brother's story in a way that could make positive changes for the community. And as someone who was on disability, advocating gave me a purpose when I really needed it most. So, I caught the bug and I've been doing it ever since. And, I feel like I'm always following in Peter's footsteps. And Amy's. I became state advocacy chair after him, the first adult with CF to do so, and was so happy that it's continued with Chad and now Marissa, because I think our voices have a very unique perspective that is very important. And also, both of my teenagers have participated in Teen Advocacy Day and have had amazing experiences. So I'm very excited for them to continue that in June.
Experts on the panel here today. I'm really excited to hear their insights. So let's set the stage a little bit. What are we going to be talking about? I don't think I need to tell you.
I think your mic.
Better? Better, all right.
There you go.
I feel like, you know what? We're gonna make a little strategic change here because I feel like that's gonna keep happening. There we go. How about that? I don't need to tell you, still better? Okay. That healthcare is complicated. As this slide shows with a lot of headlines just from the last couple months, really, it's ever evolving. And sometimes that's really amazing and wonderful and reflective of a lot of the science that we've been talking about at this meeting. And sometimes it's a little more challenging and maybe not as good as healthcare costs continue to rise. And there are a lot of different efforts made to try to address those. And too often, what we see is that people with CF, patients, get caught in the middle of those efforts to navigate those rising costs and implement a lot of programs that can be confusing and difficult and incredibly time-consuming and burdensome. A lot of new hoops. And that's really what we want to talk about today. What does that look like, and what is the foundation doing to address those and to try to alleviate that burden for people with CF and to make sure that we put people with CF back at the center of the conversation, at the focus, and really trying to design coverage areas that really address what you all need. Again, I do want to just kind of set us where we are. What do we know about how people with cystic fibrosis experience the healthcare landscape? The good news is that almost everyone with CF is insured. About 93% have coverage all year long. But we increasingly see, and have for a while, that coverage is increasingly inadequate. It does not cover everything that it needs to. And we also know that about 3/4 of people with CF don't just have one source of insurance coverage, that they rely on multiple programs, often 2, 3, 4 even, to help cover the cost and the complexity of cystic fibrosis. And those programs, as you add them to the burden of the clinical components of care, really are becoming ever-changing, and it's really looking like a game of whack-a-mole these days. As some new efforts rise up, others dissipate, there are always new challenges. And we know that with those challenges and the high cost, that it really does impact people with CF's ability to access their care, to do all the things that they need to keep them healthy. And that often those costs of healthcare can force people with CF to struggle with even basic needs. Again, we know that about 45% of people with CF each year either delay or skip their care altogether, some component of their care, because of costs. And we know that 1 in 3 people with CF struggle with food insecurity. I just want to say that again. 1 in 3 people with cystic fibrosis struggles with food insecurity, and that's 3 times higher than the national average. So what do all those stats mean? It means that cost matters, and cost impacts how people with CF can care for themselves and live their best lives. And I want to say all of those stats that I just gave you really do drive the foundation's efforts in this space. We want to make sure we really understand what people with cystic fibrosis are experiencing so that we can go and tackle the issues. And we can really strive to try to remove some of those burdens to make it easier for people with CF so that they can focus on their health care, they can focus on their lives, and we can get some of those hoops and whack-a-moles out of the way. We rely on data to do this. Our access policy is really data-driven, first and foremost by data resources like the registry. What do we know about CF care and how it's being delivered? Evidence-based guidelines is the bedrock of our advocacy with insurers. We don't want to just say, because we think it's a good idea. We bring, again, that data from the registry, that data from evidence-based guidelines, that data from clinical trials to say, this is what we know is best. And we also rely on you all. The information that we hear from care teams, from COMPASS, it's a critical component of our efforts to understand how people with CF are experiencing the complexity of healthcare insurance these days. COMPASS calls are sort of like our finger in the wind. They tell us what's going on, and they also are the first place that we hear of emerging new threats. So every day, I want you to know that we have a mighty team of amazing people who work really hard and are deeply focused on making sure that everyone with cystic fibrosis has the care that they need in a way that's affordable for them. And we know that's not always the case, and so we strive really hard to be a really vocal and loud advocate to make it better. So thank you for your stories for that. They let us do our job better. So again, as I said at the opening, we want to take the rest of our time today to look under the hood a little bit about what that looks like. What are all the different ways that people are experiencing the insurance landscape, and how can the foundation and our amazing advocates work together to make it better? So we're going to start with a couple ways of looking at how people with cystic fibrosis get their coverage. One of the ways here, again, we know that most people with CF rely on more than one way to get their insurance. And there are a lot of states, as you see up here on the map, that have either CF-specific or programs for people with rare disease that help fund services and other forms of patient assistance that are really important for people with CF. Another layer in the puzzle of how to get CF coverage and afford care. These programs vary on their eligibility and what kind of services they offer, and frankly, some of them vary on their usefulness to people with CF. But we want to take a look at one that for a long, long time has been really the gold standard of assistance programs for people with CF, and that is in Melissa's great state of New York. So Melissa, can you tell us a little bit more about the New York Adult Assistance Program?
Gladly. The Adult CF Assistance Program was an incredible program for New Yorkers with CF who were 21 and older. To be eligible, you had to have private health insurance, and it helped to fill in the gaps of coverage by providing reimbursement for CF-related medical care and insurance premiums. As you know, living with CF is very expensive, even for individuals with comprehensive insurance. I joined the program in the early 2000s when I was in my mid-20s. With the high cost of insurance premiums, deductibles, copays for doctor visits, medication. Remember when we thought Pulmazine was expensive? I had peace of mind knowing that the program would cover what my insurance wouldn't, even some over-the-counter stuff like saline for my nose and GI stuff. not to get into the details. It was amazing, and it helped so many New Yorkers.
So, as I said, that New York program was really the gold standard of all these state programs you see up on the map, and it's such an important example of a state program that was so enormously beneficial. But in maybe worst timing ever, in 2020, New York budget eliminated funding for the program. Melissa, can you tell us about the impact of the termination of this program?
Yeah, it was like the devastating ripple heard across the state. Excuse me. So because of the program, like I said, so many adults were able to access their health care, afford their private insurance, and remain financially stable. But when it was terminated, and that went into effect of April 2020, the beginning of the pandemic, many New Yorkers had to make difficult decisions about their health and their insurance. There are a few private organizations that we can turn to that that will help patient assistance, excuse me, but none of them were as comprehensive as the Adult CF Assistance Program. For example, I used one that covered my portion of our very expensive family insurance plan. Another one covered my pulmonologist copays and medications that were related to my lungs, but not any other specialist for CF, which is a multi-system disease. So like in the years following the program being eliminated, I've had to go see a number of specialists like gastroenterologists and rheumatologists and mental health professionals. None of that was covered under this plan, under these plans, whereas it would have been covered under ACFAP. So that was a big change in our financial, world. But other patients shared stories that actually made my heart hurt. As Mary was saying, there's food insecurity and people having issues paying for rent. And there were people who shared their stories about having to choose between affording their medical treatments and affording their homes or putting food on the table for themselves and their families. So it was a huge burden for a lot of people.
Yeah, we knew how important this is, and so we'd long advocated for this program in New York State for many years, as long as I can remember. But here we had a whole new advocacy challenge because we had to reinstate the program. We really had to restart it. Melissa, you were instrumental and really the sort of leading charge of all of this in New York. Can you tell us the ways that CF advocates in New York worked with the foundation to get this done?
Yes, I just want to emphasize that the policy team was phenomenal, working so diligently and guiding us for the 4 years it took to get the program back. So I need to give everyone there a shout out. So in February of 2020, some New York advocates met with their representatives because we knew that this was coming. So when it was eliminated, I immediately reached out to those legislators and held meetings on Zoom to explain the dire impact this was having for the CF community, especially considering New York City was the epicenter of the COVID pandemic. So we couldn't afford to have any adults with CF in New York lose access to care. In December of 2020, I stepped out of my comfort zone, even as a longtime advocate, and wrote an op-ed for a New York newspaper with a plea to Governor Cuomo to reinstate the plan. And over the course, there were other people who wrote op-eds too, my care center, other advocates in New York. We reached out to families through advocacy alerts, social media, and the care centers to collect stories on the impact of losing the program to then share with our legislators. Through that process, we were able to identify champions in the legislature to help bring back the program. I'll tell you more about that in a few minutes. So we worked with the policy team to build up our network by holding online advocacy updates, recruitments, and trainings to ensure the community understood how vital their voices are at all levels of participation, from responding to an advocacy alert, to calling their representatives, tweeting their representatives, to arranging virtual meetings. We're a big state, as you can see on the map. So we have 4 chapters of the CF Foundation in New York, and all 4 advocacy chairs work together to amplify our voices. New York advocates are a mighty group, and thanks to building relationships over the years, we were able to work with legislators to get this done. But it took 4 years. 4 years, it was a long slog.
Was there a breakthrough moment?
Yes. So we had a bunch of wins, as you were saying. We've been advocating for a long time for the program in relation to the budget. So, we had wins when the funding for the program passed the budget, but for some reason the funds were never able to actually find their way to patients. So one of our congressional captains downstate, Gretchen Fox, and her son Michael, worked with their assembly member, Stacey Pfeffer Amato, to submit a bill that would reinstate the program in statute. I can't tell you how many times Ashley from the policy team had to explain to me what that meant. But they were able to do that. And then with continued advocacy, Senator Thomas introduced a companion bill in April 2023. And in December, Governor Hochul signed the bill into law.
Yeah, and so it's back, right?
Yeah. So, with advocacy, we talk about how building relationships matter, and this is proof of that, but it really took all hands on deck. There were a variety of ways: email meetings, phone calls, social media posts, op-eds. New York did not take no for an answer. We pulled together to make sure our stories were heard across the state.
Yeah, it really was an amazing example of many tools, but most importantly, many voices. The entire state was amazing, as Melissa said, 4 different chapters, so many advocates coming together. And I also want to really highlight the vital role that the CF care centers across the state played. They were instrumental, they were by our side from day one all the way through. And we've been very delighted that just in the last several weeks that the program is up and running again. Melissa, do you want to sort of capstone that? What did you do just recently for the program?
Yeah, so the program was officially reinstated literally last week and began accepting signups in March. So I quickly called and got the application and signed up, and I just submit all the paperwork. So I hope all of you New Yorkers out there who are over 21 are hearing about it and signing up.
Yeah. And we're working really, again, closely with care teams to make sure they know the program's back up and that they can share that news with their patients. So it's a great example of doggedness and persistence and all the ways that advocacy has to work to make things work for people with CF. Again, you see on the map there are a lot of different states that have programs like this. Again, New York's really unique in the breadth of their services, but there are a lot of other folks in the room I know who have advocated for programs in their state, particularly highlighting Ohio and Pennsylvania as places where it's not always even keel, and we have to really rally around the programs. So another really important way that people with cystic fibrosis get their coverage is through Medicaid. Medicaid is really a bedrock program for cystic fibrosis, and it provides primary coverage for many people with CF, and it's also an important supplemental program for a lot of folks. We know about over half of all children with CF have Medicaid, either as a primary or secondary source of coverage. So it's really important. And we've also been a consummate advocate for Medicaid in a whole lot of ways, but a particular one we want to focus on today is the issue of Medicaid expansion. So as you may remember, one of the things of the Affordable Care Act did was enable states to expand eligibility for their Medicaid and let people at higher incomes come into the program. Some states did this right away, others not so much. So Peter, this is one thing that you've been involved with for a very long time. Can you tell us a little bit about what it looked like to expand Medicaid in North Carolina and get your state to turn blue on that map? Blue means that it is an expanded Medicaid state.
Absolutely. It was a long haul. You know, we started in 2014 when it was the first year the Affordable Care Act allowed that expansion to happen. I would say those first calls and meetings were not hostile, but it was not receptive. There was a lot of pushback against the ACA. North Carolina was one of those states right in the crosshairs of which way are they going. But we had a lot of pushback, and I would say it was the drip, drip, drip coming from us that got the message across, and we began to educate the lawmakers then. It was emails, it was calls, it was visits, probably thousands of touch points with our state legislators. And we pushed continuously the fact that if 50% of the kids in the state needed Medicaid expansion to get their CF care, and about 25% of adults, and those numbers we just harped on then continuously. And it through osmosis, it sunk in to a number of them. And then finally, last year, we did get approval. And I would honestly say, on paper, it was maybe even a more hostile crowd than we started with, but it was the continual messaging highlighted by the meeting in 2022 when we brought in a CF advocate. We brought in some top docs from the CF Care Center at Chapel Hill to meet with legislators focused on the healthcare issues. But in the end, it was really interesting. The combination, it was what we could do locally in the state, but also credit to all of you in this room, everyone on the virtually, who was fighting for the Affordable Care Act. Because I think it was the tables turned when some of these legislators have been hearing our message, finally realized that the Affordable Care Act was inevitable that it was going to continue. So why not finally jump on the train 9 years later? But again, thanks to Mary and her team, there were so many efforts going on behind the scenes, and I just would make that point. Like, for example, I bet Melissa had no idea how much was going on in North Carolina. I had no idea how much was going on in the states of New York to save her program. And for all of you, I just rest assured that the team that they have is operating behind the scenes. When there's a hot point that comes up in any of these states in the country, they are on it. So something you can feel we're so proud of and so grateful for.
And I think if we can flash the map up one more time, you'll see orange means no Medicaid expansion, so it's nice to see all that blue. and we are still seeing progress here. Just last month, the state of Mississippi, the House in Mississippi passed Medicaid expansion unanimously. It's not done yet in Mississippi, but that's a real promising sign. So we'll keep at it, we'll keep advocating, and if it's going on in your state, we'll be sure to let you know how you can help.
So I'm going to just pivot for a different part here. And Mary, can you tell us some of the ways the foundation is working to reduce burden on patients?
Sure. So again, as I said at the opening, we know that CF is time consuming, and that's not always cleaning your nebulizer or taking your pills. A lot of time it is about navigating insurance. And many of you have shared with us that that's some of the most stressful things that you have to deal with CF and some of the most time consuming. So I want to talk particularly about some of the ways that we watch that and try to see where we can make a difference. So many of you probably know what prior authorization is. PAs, you might hear your term with your care team. So it's a component of your insurance that sort of is one of those hoops that you have to jump through. Can I have this medication? Is it okay? It's a way your insurance sort of governs how you're getting your coverage. And there are two places here that we particularly watch and we're particularly active on in terms of CF care. One, to make sure that insurance component of prior authorization is clinically accurate. And unfortunately, it is not always the case. We see sometimes in insurers, and these cases often come through Compass, or a care team alerts us to a particular problem with an insurance plan where certain types of treatments for CF are more difficult to get approval for. And we particularly see this and watch extremely closely coverage criteria for CFTR modulators, right? We know those are places where insurers are more likely to place burdens in front of you to get these drugs because they are expensive. And so that's a place where the foundation really jumps into action when we see criteria that just isn't clinically accurate. So for example, we see in the most egregious cases, requirements that make you prove every quarter that you still have cystic fibrosis. That's, someday we hope that the answer is no, but until that day, it's not an okay criteria to put in place. And we also see a lot of restrictions around things like lung function, right? What your FEV1 is. If you're over or under a certain FEV1, then the insurer tries to knock you out of approval for your CF drugs. And those are absolutely unacceptable and places where the foundation really goes to bat very vigorously, again, with that data, those clinical evidence-based guidelines. We often work very closely with your care teams when we see that to hammer the insurers and get them to change their mind. But I also think this is another place where we're starting to see some glimmer of hope. And we worked to create model legislation with the American Medical Association, which is has a little bit of clout sometimes in Congress and particularly in states, to try to make changes in legislation that reduces how much prior authorization can be utilized and extends the amount of time that once a prior authorization is achieved that it can last for. So the particular example that I'm really excited to share was about a year-long effort in the state of California, where we worked very closely with their Medicaid plan to expand prior authorizations for all CF medications that goes up to 5 years. So one prior authorization for 5 years. That's a lot less paperwork. And we're also watching this pop out in a few other states where optimistic that this is something that may take traction in other states, and others will be interested in hopping on this train to relieve the burden of prior authorization. Again, we have particular legislation for rare diseases to make sure that the burden is lessened. We are seeing action in Vermont, Ohio, North Carolina, a few others like that. So we're excited about that. Melissa, I'm going to move us on to a couple quick flags because I'm looking at our time. I do want to flag, we've talked about it a couple of times in this situation, but I do want to really flag how important Compass is in all of this picture. We know that that there's a lot that needs improvement in the U.S. healthcare system, and we work in the policy space to make sure that we are relieving those burdens. But as you heard from the New York example, as you heard from the North Carolina Medicaid example, as you watch in the HELP Copays example, this takes time, and we know sometimes the problem is now. And I want to just make sure that everyone in this room knows and online how that Compass is there for you. We can help you navigate these complexities when they arise. If you have an insurance challenge, please don't hesitate to reach out. And we also hope that you see Compass as an opportunity to help even before issues arise. The case managers at Compass are amazing, as we heard about in the story on Thursday night, that they really can help you understand your plan options in areas like open enrollment, and to help you create strategies to navigate coverage, either before to pick the right plan or to navigate a coverage challenge when it arises. And I think, especially in open enrollment, want to point out that that's a prime time to engage with Compass, because understanding your plan options can, again, help avoid some of those access challenges down the road, and can be an opportunity to sort of mitigate some things that you might see if you have a plan in place. Just a little fun statistic, of those people who called Compass during open enrollment to assess their plans, only 4% called back the rest of the year with a problem. And only one of those issues were not discovered during their open enrollment. So let us help you really at the head of the time. Yeah, Melissa.
I was just going to say, insurance plans, companies just decide to change them on a whim, and we have never not called Compass to go over every change in plan. They've been amazing for us.
Yeah, so call early. Let us help you. Hey, Peter, can you just also, I think a lot of people in this room were up on the Hill on Thursday, and we're talking about Help All Copays Count, but not everyone. Can you just sort of give us a summary of that coverage landscape issue that we're working on?
Yeah, very quickly. Another attempt to remove the cost burden from patients is the HELP Copays Act, which, as many of you know, seeks to eliminate copay accumulators, which have been moving this burden onto patients. And I know we're running low on time, but I think everyone's fairly comfortable. But I wanted to make, one important point about this, and it feeds into how we do advocacy. I talked about the 9-year experience in North Carolina. We were really warmed to get the reaction we did to HELP Copays in general on Thursday. And I know Milton's story from that night, where getting his congressman on board, Jamie Raskin, it was only a matter of highlighting this issue, getting it to the top of his inbox. The congressman had no idea this was even out there, because he's a very busy man. But with Milton's efforts to say, this is important to us, let's do it, by the end of the day, he had signed on. So it's sort of the contrast between the 9-year versus us just saying, hey, we're here, this matters, let's do it. So I want to draw that example from the other night. One thing, Mary, there's a lot of press about are some of these drug affordability boards. And I know there's been some experiences you've had, but can you talk a little bit about what those are and how they do impact CF patients?
Yeah, I'm happy to. Well, as sort of as a pre-work for these prescription affordability boards, well, again, we mentioned this earlier in the week, but I would love for you to take out your phone right now and scan this QR code, because this is really a vital tool for what I'm about to talk about, for all the things we just talked about, for anything that we aren't aware of that we might be dealing with in July. And that is, what is your experience with somebody with CF when it comes to healthcare coverage and cost? This is all those statistics I keep throwing at you about people's experience with cystic fibrosis in the healthcare landscape comes from this survey. We're running it again now. It's out in the field. It is really a bedrock of the Foundation's policy and advocacy work in this space. So I plead with you to please take this survey. Not now, it takes about 15 minutes, so we want you just to listen to us for the next 15 minutes. But we really hope maybe if you have some downtime or on the plane on the way home to take this survey, to please share it with your network. We need a lot of different voices in this to make sure that we really have a full reflection of everyone in the CF community's experience. I can't emphasize enough how important the data we get from this tool is in all the work we're talking about today. So asking you to please help us out here, and also please spread the word. Okay, you asked me about sort of an emerging issue, prescription drug affordability boards. Some of you may have heard about this. Others of you might be looking at me and Peter saying, what the heck are you talking about? Let's try to unpack it a little bit. And we want to unpack this because this is an emerging trend in a lot of states, and many of you may be hearing from us about this issue. Again, no news that the issue of drug cost is a hot button, and it's a political issue. And there are a lot of different ways that both parties are trying to address the issue of high drug costs. One of them is this new relatively new idea from emerging in states about a prescription drug affordability board. I am going to do what you're not supposed to do, and I'm going to read the slide on this because these things are a little bit complicated. So these take various forms in different states, but the bottom line idea here is a board established by a state that reviews high-cost drugs. And the point of the review is to decide if they are unaffordable to the people who need them living in the state and or the state's healthcare system. So their goal, the reason they're getting stood up, is to try to address and reduce drug spending in the state and to improve affordability for state residents. Again, the way these look in the states has varied, but that's the bottom line concept here. And so we want to talk you through a little bit of this. So here's this map of where these boards are either established and have been passed in legislation, or where there's legislation pending to consider them. And I want to talk to you a little bit about what we experienced with this in one state, Colorado. So as you see, several states have done established these prescription drug affordability boards, but Colorado was really the first one that barreled ahead to implement them. And so they had their board, and they picked 5 drugs for their first review that the board went through. So 5 drugs where the state was going to ask, is this drug unaffordable? And one of the drugs that was picked was Trikafta. Just so you know, Trikafta was, for the state of Colorado, the second most expensive drug for the state. In other words, it was the number 2 drug for which the state paid the most money for. Does that make sense? So that's why that's on the list, right? That's of note. And so the question on the table in Colorado was, is Trikafta unaffordable for people in the state and or the state itself, right? And so what we did in helping them to answer this question was give them the perspective of the CF community and a whole lot of data. We really went into this effort working hand in hand with the CF community in Colorado, and I want to give an enormous shout out also to the CF care teams in Colorado. JTC is sitting here, right here. As I hope you hear me say, in just about every one of these fights, your care teams are locked arms with the foundation, and they are essential messengers for us in all of this. And again, I do want to, particularly because she's sitting right there, want to recognize the 4 CF Care Center directors in Colorado for their amazing time and incredible advocacy as we navigated this prescription drug review. JTC, Scott Sagal, Jerry Nick, they spent countless hours testifying, providing information, answering questions to the board. They were amazing champions for their patients and made sure that the state review board had every piece of information they needed as they were answering the question, is this drug unaffordable? And the community also provided an enormous amount of information to the state. Our job was to lay out the table and help them make the decision. And what we really told them was how important the drug was, how essential it was for people with CF, what it meant for their clinical care, and also gave them a perspective about what that coverage looked like and how people were experiencing the affordability of the drug. And so really we sort of went in with a level head of, all right, this is a fair question to ask. If this drug is the second most expensive for you, state of Colorado, is this affordable or is it unaffordable? And through data and experience and stories and amazing advocacy, what the state came back with was, it's a weird way to say it, but no, Trikafta is not unaffordable. So the bottom line is, because of all this amazing advocacy in Colorado and an enormous amount of data and facts, the state had removed Trikafta from consideration for their affordability board. Does that make sense? So we're going to see this in more states. We are already seeing it in more states. And what I will tell you, like I know Laura Gordon has already gotten a shout out this morning, but she and I have had some conversations about this. What I'll tell you, in many of these states where they're underway on these boards, they're coming to the CF Foundation. All these other states watched Colorado really closely, and they've reached out to us and said, can you come talk to us about your experience in Colorado? Can you come tell us how this worked and how we might be able to work with you if a CF drug is under review in our state? And those are dialogues we want to have. We want to be able to have that open conversation about why these drugs are so important and how people with CF experience them. And we're also doing it in all the states that are considering legislation, taking what we learned from our experience in Colorado to amend and improve the legislation to make sure that if these boards happen in these states, that we are well positioned to be able to inject our data, our clinical expertise, and patient voices at the table so that the story is told comprehensively, and we really make sure that there's a full perspective here. I just want to make sure that we hit on what the foundation's position is on all of these, which really kind of summarizes, while this is particular for the prescription drug affordability boards, it really summarizes our position on drug costs in general and efforts to address them. That we believe that every person with cystic fibrosis who can benefit from treatments must be able to access them and afford them. Our priority is to preserve access to those therapies, and that we believe that the patient, the person with CF, has to be at the heart of the question. That is how you should be evaluating the consideration. What does it mean for somebody with CF? So it's essential that our voices, your voices in your experience is at the heart of the issue. So that's how we'll be pursuing this. We're not afraid to have the conversation, but the person with CF has to be at the center of it. You want to keep going?
So Mary, if I see on the map, Virginia and South Carolina have introduced bills. I'm in North Carolina. What do we do if one is introduced in our state? What's our next step?
So if one's introduced in your state, you'll hear from us, and we'll be in touch, and we'll work together to make sure that, again, that CF story is front and center, and we make sure that if this goes forward in your state, that the CF story will be very clear. And again, I want to emphasize, from the experience in Colorado, we're seeing that happen already, and I think we're having really positive, constructive dialogues with many of the states on the map about what this might look like for CF. So Peter and Melissa, there's an awful lot going on, and I think even though we're almost an hour in, we've really only scratched the surface on the issues in this space. Let me turn it back over to you. What does everybody need to know about this? How do they get involved writ large?
Well, I'm going to talk first about what everyone is, or a lot of people's heard about. It's this Captains program, which really connects all of us to our state advocacy programs. And just some background, I first heard about this, it was 2018. I'm walking down the street in Raleigh with Dave Elin, and he says to me, you know what we're going to do? We're going to have a constituent in every district, and they're going to have a relationship with their local office, which will translate in a relationship with the federal office. And in my brain, I was thinking, okay, we got 13 districts. We now have 14, but 13, and I can count on my hand. We got 3 or 4 advocates I think could do that. So in my brain, I'm going, Dave, you're kind of insane, but let's give it a shot. And then Dave Elin, and you guys know Dave, when he gets excited, his eyes get big, he starts talking really fast, and then his hands start moving. And he says, and he turns to me and says, Peter, I'm talking about the whole country. I'm talking about 435 districts, and then I knew he was insane. But, you know, shame on me and Amy for questioning anything the CF Foundation wants to do. We always say, and Bijal did a great job last night, of everything from finding the gene to high throughput screening to venture philanthropy that became the monetization to having a patient registry to Dr. Ramsey's building of this clinical trial center for 30,000 patients to run clinical trials that the FDA would say, yeah, that works. To Compass, to all these world-class operations that every every nonprofit would love to have. And so we always say, you know, the foundation says, we're going to do a moonshot. The foundation does the moonshot, they land on the moon, they refuel for a little bit, and then they go land on Mars. That's what we're used to. So, so the program really has been a game changer. It establishes a relationship between myself and all the other captains as direct links to their local offices. And we learned several years ago, I think the Strubys did a speech when they were national advocacy chairs, and we learned that all the research says the most important person, of course, is the representative, him or herself, but the second most important person is the district director in that local district. That's the person who has the relationship with constituents. That's the person who helps set the agenda for what's going to go on in Washington. So my experience has been tremendous, and I know talk some more about that, but Melissa, you've had some experiences too. I'm curious. You're as a captain.
I've been a congressional captain since you guys brought it to all of us. And you know, it's on the most basic level, I share advocacy alerts with friends in my district. So even if I'm their only relationship to CF, they're hitting that office with the needs for CF families. You know, I kind of treat it like a Great Strides team, you know, and instead of sending asks for money, I ask them to take 2 minutes out of their time to send an advocacy alert. You know, in my district, excuse me, I work on building relationships with my legislators. I attend town halls and show up at other meetings, whether it's virtual or online. I'm that like pest who shows up at everything and like throws in either a question about CF or introduce myself and give my little elevator pitch, you know, as they're walking out. And you know, I like having meetings in my local districts. You know, they're more relaxed and casual than going to DC or Albany. When you're in district, your legislator is here to listen, to meet constituents and hear from them. So they're more relaxed and they're focused on you. And you have a bit of a better chance of meeting your actual official in New York and DC. I never do. But again, the district director and other staff are just as important. So, don't knock that. I also feel like it's a great opportunity to bring other people in the community to share their CF story, especially someone with CF. While I can't bring someone with CF to a meeting, I've attended virtual advocacy meetings with other adults with CF. And I can't begin to tell you how empowering it was for all of us to share our different experiences, because we all have a different CF story. But it made such an impact on our legislators and their staff.
And I just talk about one quick anecdote. We had a last meeting we had back in my home district in Western North Carolina. We have now a group of about 20 that have joined me to say, hey, we're going to help and bring up issues. And by having 20, I was able to select to go to a meeting a woman whose son had issues with copays, and then a CF patient who is so charismatic, who, as Marissa talked about the other day, she's one of the ones who's down to kind of one more option when it comes to antibiotics, and so impactful to have them there. I want to add one other thing from Thursday, which drove this home to me. We were meeting with my congressman's office here. We had a brand new, so smart, so earnest, really interested, but she was brand new to healthcare, let alone legislative stuff. And when I was able to tell her, well, Chris Burns, district director, I've talked to him, I've met with him, I know him, I've got emails from him. It added so much credibility to us being there. With one more lobby group. It's like we had actually done the work, you all had done the work to set us up for that credibility, but it also adds accountability. Like, they know that I have a relationship down there with someone who is close to the constituents. So her ears perked up, and it set us up for a continuum of that relationship, and really on both sides, both federally and at the local level. I think we're at time. The light is flashing. It's very exciting. What we want to do now is just say, this is a call to action. You guys have had unbelievable experiences on Thursday. I'm telling you, it's what you've done 99.9% whatever you have to do back in the district. And while for all of us, I think the icing on the cake is to come here and have this crazy experience in Washington and walk the halls and meet these important people. If that's the icing, the cake is actually back in your district. That's where the work needs to be done. And we want all of you to think about how you can be involved back in the local district. I would love if there are district captains in the room, please stand so we can recognize you, and not only recognize you, but everyone, for the next half of the day, use them as a resource to understand what it would be to be a district director. There are a lot of districts that still need captains, and it's not district director, captains. Well, I'm promoting all of us. This is. There are maps outside as you leave. Pick up your state and see where there's coverage and where coverage is still needed. If you have coverage and there's a captain in place, get to know that captain, volunteer to be on the committee. You can be one of those 20 people that I can call on to go and visit and make our voice heard. Beyond that, if you make sure that not only you, I'm sure everyone in this room is getting advocacy alerts, but your friends, your family, expand that universe, go home, get 10 more people to sign up. The whole idea is to make this community of 40,000 patients and all their related loved ones, make it an army. And Jeremy, if he was up here, gosh, I wish he was up here, he would have us all running back home as fast as we could to get this done. But I'm not really a New Testament or an Old Testament guy. I'm not really a Testament guy. But I would say, let's go forth and multiply. So let's do it. So thank you.